The last part of this lecture on pulmonary ventilation is spirometry. Spirometry is a way in which lung volumes and capacities can be measured. Now, spirometry utilizes a thing called a spirometer. We have two types of spirometers in lab that we'll use, and what they do is they allow a physician to evaluate pulmonary function. It can be used to evaluate the course of certain respiratory disorders. It can be used to distinguish between obstructive and restrictive lung diseases. Obstructive lung diseases involve problems with or increases in airway resistance. Restrictive lung diseases interferes with lung expansion. So changes in different lung volumes capacities helps to distinguish between different types of lung disorders. The thing that I want people to realize is, depending on what textbooks you pick up, the numbers they give you, the values they give you for various lung volumes capacities, there's going to be some variation there. It does exist. Some of the variations that you see is because of things like your age, your height, your gender. The numbers that I have in the lab manual versus lecture manual, purposely used to be a little bit different, actually going to be a little nice and give you some ranges, is you need to get used to the confusion. There is going to be some variation in the numbers. I'm going to give you the values. As long as you have a ballpark idea of where these numbers are, you'll be good for your board exams. So first thing though, I want you to realize that values that you get will vary because how old you are. The older you are, lung volumes and capacities diminish as you get older. Your height, the taller you are, the larger the lung volume and capacity. And your gender also plays a role. The females, your numbers tend to be 20 to 25% less than males. So generally the numbers they give you in textbooks are for males. Usually usually about 25-year-old males. I don't remember the exact height, but it's kind of just a general normal height for males. Now what we're going to start with is we're going to look at what we call a spirogram, and these represent you, if you're going up this way, you're inhaling, coming down, you're exhaling, and you're going to be doing different things, and the spirogram kind of represents the changes in volumes and capacities. Over here I could have some numbers, I just chose not to put some numbers, but we're going to start right here where, say, you just finished exhaling and you're starting here. There's a certain volume of air already in your lungs, but what we're going to do is first is ask you just to inhale and exhale normally. So you're going to follow this. You're going to inhale, exhale, inhale. Of course, then this is going to be a different thing. But your normal amount of air that you inhale and exhale during a breathing cycle is called your tidal volume, which we abbreviate as TV. Tidal volume, think of it as the tide. It comes in and it comes out. So tidal volume can be defined as the amount of air inhaled or exhaled during a normal breathing cycle. So a normal breathing resting cycle, tidal volume is about 500 mils. Now this one is pretty much the same between males and females, so this is a pretty consistent number. So on average it is about 500 mils no matter if you're male or a female. Tidal volume obviously can change, say during exercise. During exercise your tidal volume can be much greater than 500 mils, but the numbers that we're giving you is for normal breathing cycles. The next volume is the expiratory reserve volume, which you see right here, ERV. What we're going to ask you to do is you're going to, inhale, exhale, inhale, and then I want you to force all the air out of your lungs as you possibly can. You're just going to use those accessory muscles, abdominals. Get all the air out of your lungs as you possibly can. And the expiratory reserve volume starts here. It's the amount of air that can be exhaled after a normal exhalation. So you see it here. So here, it's the amount of air exhaled after a normal expiration. On average, it's between 1.1 in 1.5 liters. You can express this in mils if you want, so it'd be 1,100 to 1,500 milliliters. That's your expiratory reserve volume. Even when I ask you to get all the air out of your lungs that you possibly can, till you're coughing and gasping, you still will have a pretty significant amount of air left in your lungs. So if you notice here, you did a forced exhalation. There's a certain volume of air still remaining in your lungs, which we define as your residual volume. So the residual volume is defined as the amount of air left in the lungs after a maximum expiration. So it ranges anywhere from 1.2 to 1.5 liters. The last volume is our inspiratory reserve volume. So one of the things we're going to ask you to do in lab is to take as much air in your lungs as you possibly can. And your inspiratory reserve volume represents the amount of air that you can get in your lungs after a normal inhalation, how much air you have on reserve. So if you notice here, it's the amount of air that can be inhaled after a normal inspiration. It ranges between 2.5 to 3 liters, 3 liters. So it's the amount of air that you have on reserve. We can go back to this one, the expiratory reserve volume. Why they call it expiratory reserve volume is, again, how much you have on reserve. How much extra air could you get out of your lungs? So that's why they call them reserve volumes. Remember, this one is a residual volume. It's called residual volume because it resides there. You can't get out of your lungs. It's the air that resides in your lungs. The capacities are how they differ from a volume is that capacities are composed up of 2 or more lung volumes. So if you notice, the first capacity that we're going to talk about is your inspiratory capacity, or your capacity to inspire. It includes 2 of your volumes. It includes the tidal volume and includes the inspiratory reserve volume. So what you were going to do, what you could ask you to do to measure this is, after a normal exhalation, take as much air in your lungs as you possibly can. You're going to expand that rib cage, use all those accessory muscles of inspiration, get all that air in the lungs as you possibly can. That inspiratory capacity is defined as the amount of air that can be inhaled after a normal expiration. So you'll see it's composed up of your tidal volume and your inspiratory reserve volume. It averages anywhere from 3 to 3.5 liters. The next capacity is our functional residual capacity. That's the one we had defined at an earlier point in the lecture, where we said after a normal expiration, when the outward recoil of your thoracic wall is matched to the inward recoil of your lungs, that volume of air left in your lungs is your functional residual capacity. So you'll notice here, after a normal expiration, that amount of air that's in your lungs at that normal expiration. So you can write it down as is being defined as the amount of air in the lungs after a normal expiration. It's composed of 2 volumes, the residual volume and the expiratory reserve volume. So you see it right here. So it's your expiratory reserve volume plus your residual volume. It averages anywhere between 2.3 and 3 liters. The next capacity is called your vital capacity. You'll notice it's composed up of 3 of your lung volumes. It's your inspiratory reserve volume, your tidal volume, and your expiratory reserve volume. So we'll be measuring this in lab, and what I'm going to ask you to do is take as much air into your lungs as you possibly can. So you're going to get all the air in your lungs as you can, and then I want you to force it out and get all the air you can get out of your lungs as you possibly can. So you're going to go until you're just blue in the face, force all that air out of your lungs as you possibly can. That vital capacity represents the amount of air that can, obviously I spelled this wrong, that can be expired after a maximum inspiration. They call it vital capacity because in Latin, vita means life. So it represents the air that can be exchanged, or air that's needed for life. That's why they call it vital capacity. You'll see again mathematically, it is composed of your three of your volumes: tidal volume, inspiratory reserve volume, and expiratory reserve volume. It averages between 4.5 and 4.6 liters. Now the very last capacity is your total lung capacity. It's all of your volumes. So it's your inspiratory reserve volume, your tidal volume, your expiratory reserve volume, and your residual volume. So what can be done, which we will not be able to do this in lab, but if you take as much air out of your lungs as you possibly can, the amount of air that's in your lungs is referred to as your total lung capacity. So total lung capacity is the amount of air in the lungs after a maximal inspiration. So it's composed of all of your lung volumes. Now it averages between 5.8 and 6 liters. Now I had mentioned to you that we're not going to be able to do this in lab. Well, I want to bring to your attention that in lab, with the spirometers that we have, we are unable to measure residual volume. You have to use special techniques to measure residual volume. So anything that includes a residual volume, we're not going to be able to measure in lab. But we'll be able to measure a good number of these in lab using the different spirometers that we have. Now, another thing that's important to be able to do is to evaluate pulmonary ventilation, is to look at someone's minute respiratory volume, or what they call minute ventilation. It represents how much air that's being moved into and out of the lungs per minute. This is relatively easy to do. If you know the patient's tidal volume and you know their breathing rate, you can determine their minute respiration or their minute respiratory volume. So a normal breathing rate is about 12 breaths per minute. A normal tidal volume is about 500 mils. So that person's minute ventilation would be 6 liters per minute. Now that's a nice thing to know. You'll know how much air is moved into and out of the lungs per minute. But what's even more valuable to know is actually how much air that can be exchanged. How much air, or the rate of air that reaches that functional unit down at the alveoli. So what we need to measure is something called alveolar ventilation. So that really determines your ability to deliver oxygen to the alveoli. Now, alveolar ventilation will always be less than minute ventilation, because remember, we have parts of the airways that do not participate in gas exchange. We have dead space, and everybody has anatomical dead space. Now, anatomical dead space, we had mentioned before, is equal to a mil per pound of ideal body weight. So you have to take in consideration that if my ideal body weight is 150 pounds, there's 150 mils of air that will not participate in gas exchange. So my alveolar ventilation is going to be less than minute ventilation. So we're going to show you how you can calculate it. There are some people that have alveolar dead space. Now, alveolar dead space would be found in people with, say, emphysema or other lung conditions. There's something wrong in order to have alveolar dead space. You got some collapse of airways, or it's obstructed by mucus, or maybe the alveoli is ventilated but maybe not be perfused. So that represents alveolar dead space. So again, that will not be able to be exchanged. Now, physiologic dead space is a combination of these two, 1 and 2. Your physiologic dead space is anatomical dead space and any alveolar dead space that you have. Now this can be calculated, can be determined, but obviously we will not be able to do it in lab. But they can measure a patient's alveolar dead space if need be. Now what in order to do to determine the alveolar ventilation, which is a rate, alveolar ventilation is a rate, just like minute ventilation. In order to calculate it, again, you need to know the breathing rate. And so we're going to say here's a normal person with a breathing rate of 12 breaths per minute. You need to know their tidal volume. And then you need to subtract out any dead space. So this here is going to refer to you subtract out any physiologic dead space. So that will include anatomic and alveolar dead space. So my example here is this is a normal individual, so they only have anatomic dead space. So their physiologic dead space is just that 150 mils, because we're going to say this person's ideal body weight is 150 pounds. So if you subtract out that dead space from their tidal volume, you would get 350 mils. So if you multiply 350 times 12, you get an alveolar ventilation of 4.2 liters per minute. So alveolar ventilation is a rate. Minute ventilation is a rate. So the units they will use is liters per minute, or if you want, you can do it in mils per minute. So if you want to say 4,200 mils per minute, that would be perfectly acceptable. Now, if you have an example of someone with alveolar dead space, you need to, if it has been given to you, you need to subtract that out also. So please be careful. If you read any questions, any case studies that ask you to calculate alveolar ventilation, that you need to take in consideration anatomic dead space, which you'll be able to determine by the person's body weight, and you need to subtract out any alveolar dead space. Now, if there's alveolar dead space, it must be given to you. If we give you their physiologic dead space, we've already given you the numbers to subtract out. You will have to do some examples in lab, and you will be required on an exam be able to calculate alveolar ventilation or minute ventilation. So please make sure that you know how to calculate those.